Hi everybody, welcome to this video on cancer classification. So I really wanted to go through a brief explanation of different types of cancers and how these are broken down histologically, because I think that this is not very clear, especially as like a medical student, and it is important in terms of people who are going into primary care fields or into oncology related fields or radiology, anything like that really. So basically this is all just taken from the NIH website. I think they kind of broke this down nicely, so I'll go through each one as best as I can in as short of time as I possibly can as well. So the first one here is going to be carcinoma. And carcinoma is a very broad term. I think that this term can be kind of used interchangeably with cancer for some people, but carcinoma more specifically is not just cancer. It is cancer, but it's a more specific definition. So it is a neoplasm, a malignant one that is of epithelial origin, or cancer that involves external or internal parts of the body in terms of the lining of the body. So epithelial tissue is most commonly associated with skin, and then it's also associated with linings of organs and internal structures such as our GI tract. And then carcinomas are going to be divided into two major subcategories. So this is going to be adenocarcinoma, which is associated with like glandular structures and organs, and also squamous cell carcinoma, which is going to be involving the squamous epithelium. So adenocarcinomas are oftentimes associated with mucous membranes, and squamous cell carcinomas can occur in many parts of the body. So you can see it in the vulva, you can see it in the you can see it in the lung, you can see it in the skin, you can really see it in a lot of different places. So important to be aware of squamous cell carcinoma. You can see it in the esophagus. There are a lot of different places where you can see this here. And then so most carcinomas are going to involve organs or glands that are capable of secretion. So that would be breast, lungs, colon, prostate, bladder, for example. And then I wanted to go briefly into sarcoma. So sarcoma is a term used to describe cancers for patients who are, or for patients who develop tumors in supportive and connective tissues. So this is like bones, tendons, cartilage, muscle, fat. I kind of think of this as like the rheumatologic or ortho kind of domain in terms of cancer. Obviously it's not managed by rheumatologists usually, but I just kind of associate it with that field because it helps me remember it a little bit better. And then, this is kind of, in terms of test taking, I mean, you can think of things such as osteosarcoma and those types of things that are kind of, I wouldn't call them high yield on USMLE, but they are in first aid, so it is where you kind of get that coverage for these tumors. And then there's like chondrosarcoma, and then you can think of other sarcomas, especially when you're on OBGYN. I feel like there's so many different cancer types, and sarcomas are some of those. Mesothelioma, of course, is going to be associated with lung cancer. And then gliomas and astrocytomas are associated with neural tissue, and so on and so forth. So that's kind of a brief overview of sarcoma. Myeloma is its own category, so that is going to be associated with plasma cells in the bone marrow, and these plasma cells are going to produce IgG, just immunoglobulin in general, and these can be found in the blood, and they are detected with, of course, like SPEPs, or, sorry, my pen isn't writing very well, SPEPs, or immunofixation. And then the next one that we have is leukemias, as well as lymphomas. For some reason, my lymphoma, I forgot to highlight it here, but you can kind of see that there are, especially when you're doing like a hematology rotation or anything like that, leukemia and lymphomas are used sometimes it feels like they're like confused with each other. But the easiest way to remember it is like leukemia, you think of a liquid tumor, and lymphoma, you think of solid tumor. So leukemias are associated with the bone marrow and bloodstream, and lymphomas are usually associated with a solid, or they are solid cancers associated with like things like lymph nodes, or the spleen, tonsils, thymus. And then you can also see them in areas such as the stomach, like malt lymphoma, or like malt is associated with like the stomach, and then you can see it in the breast as well as the brain, so like CNS lymphoma. And these ones are extranodal lymphomas, the ones that I mentioned towards the end. And then the last thing that you have to know about lymphomas, which makes it even more confusing, is that there are different subtypes of lymphoma. So these are, of course, Hodgkin lymphoma and non-Hodgkin lymphoma. And clinically, these are kind of important to know because like patients may present with these symptoms like night sweats and all of that. So it's important to be able to correlate that and think about lymphoma in those cases. So basically the presence of those Reed-Sternberg cells, or those like owl eye cells in Hodgkin's lymphoma, distinguishes it from non-Hodgkin lymphoma. The way that you can remember this is like no from the no Reed-Sternberg cells, if that helps. And then lastly, we have a mixed type here as our final category. So any of the aforementioned categories can be combined together. Some examples of this are going to be adenosquamous, mixed mesodermal tumor, carcinosarcoma, or teratocarcinoma. So I hope that helps. Just very briefly introduce you to the different histological subtypes of cancer, how they're divided, and why these can also be like clinically important. And I hope it helps you on your exams and whatever you're studying for in terms of your rotations. Thank you for watching. Of course, if you have any questions, feel free to let me know. Thank you, and have a great day. Bye.